itu kerajaan memutuskan untuk melaksanakan Perintah Kawalan Pergerakan mulai 18 Mac 2020 iaitu lusa hingga 31 Mac 2020 di seluruh negara.
Assalamualaikum and hi, I'm Nurizati binti Muhammad Nazri. In this video, we are going to educate you more about COVID-19. What is COVID-19? Coronaviruses COVID-19 are a type of viruses that can infect humans and cause respiratory disease. They are named corona because the virus surface has crown-like spikes. Coronaviruses that cause sickness in humans include severe acute respiratory syndrome SARS, Middle East respiratory syndrome MERS, and the common cold. COVID-19 enters the body via the mouth, nose, or eyes, directly from the airborne droplets or from the virus in your hand to your face. The virus separates to the mucous membrane in the back of your throat and the rear of your nasal passage. It binds to the cells, their multiples, and spread into the lung tissue. The virus can then separate to other body tissue. COVID-19 can attack anyone regardless of age and cause death. However, those who have serious medical history like diabetes, chronic respiratory disease, or cancer, and the ordinarily more likely develop serious illness caused of COVID. The most common symptoms of COVID-19 are fever, cough, tiredness, and loss of taste or smell. For the serious cases, patient will have difficulty breathing or shortness of breath, loss of speech or mobility or confusion, and chest pain. Please seek medical attention if you have this kind of symptom. Now, I will pass to Wan Nusairah binti Wan Nur.
Thank you to Nurizati for the introduction. Hi and Assalamualaikum. My name is Wan Nusairah binti Wan Nur. For my part, I will describe methods or steps that we can take to reduce the risk of COVID-19 infection. First, put on a mask. Face masks have become essential tools for protecting yourself and others from COVID-19. The CDC advises people to wear face coverings in public places, especially since studies have shown that people infected with the novel coronavirus may be asymptomatic or presymptomatic. Wearing a mask that covers your mouth and nose reduces the risk of serving as a source of disease spread by trapping your own droplets in the mask, as well as the risk of getting sick from coronavirus containing droplets by blocking access to your own airways. Despite the fact that it has almost entered 3 years of fighting the disease, there are still a few people who still do not know how to wear the mask properly. Here are some simple tips on how to wear a mask correctly. Second is wash your hands. Good hygiene is an important habit that aids in the prevention of the spread of COVID-19. Make the CDC's recommendation a regular part of your routine. Wash your hands frequently for at least 20 seconds with soap and water, especially after being in a public place or after blowing your nose, coughing or sneezing. It's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing or sneezing, after handling your mask, after caring for someone who's sick, and after touching animals or pets. If soap and water are unavailable, use a hand sanitizer containing at least 60% alcohol. Apply sanitizer to all surfaces of your hands and rub them together until they feel dry. Unwashed hands should not be used to touch your eyes, nose or mouth. That's all from me. Now, I will pass to Nuruz Nina. Thank you.
Thank you, Wan, for your information. And now it's time for me to share information about the impact of COVID-19. So before I start, I want to introduce myself first. My name is Nurul Husnina binti Hamidun and I'm from class BA1185H. By the end of 2019, COVID-19 had been discovered in Wuhan, China, and then it spread rapidly to the rest of the world and including Malaysia. Coronavirus disease 2019, or better known as COVID-19, has had a negative impact on our life, whether in health, economy, education, and so on. It is well known that the COVID-19 pandemic has negative impact on human health both physically and mentally. Firstly, COVID-19 can impact on human physical health. This killer virus is indeed a danger to humans because if a person does not have a strong body defense, it will cause a death. Some will become seriously ill and require medical attention. Other people and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease or cancer are more likely to develop serious illness. Anyone can get sick with COVID-19 and become seriously ill or die at any age. Furthermore, Director General of the World Health Organization (WHO) said that the virus, which turned out to be not only fatal but to also trigger long-term effects on a handful of individuals. He said that the symptoms recorded so far include fatigue, cough, shortness of breath, inflammation, and injuries to major organs of the body. The affected organs include the lung and heart, as well as neurological and physiological repercussions. These symptoms typically occur concurrently and might impact any bodily system. In fact, until today, COVID-19 related death cases have reached over 31,000 in Malaysia and over 5 million deaths worldwide recorded. According to some former COVID-19 patients, they admit that the virus affects their quality of their physical health. They often easily feel weak, dizziness, and experience shortness of breath even when they're not doing heavy work. And secondly, COVID-19 also can impact on human mental health. As the coronavirus pandemic spread over the world, it is causing widespread anxiety, worry, and concern among the general public, as well as in some groups in particular, such as older persons, caregiver, and those with underlying health concerns. Until now, the major physiological impact on public mental health has been increased level of stress or worry. However, if additional restrictions and consequences are implemented, particularly quarantine and its effect on many people's typical activities, routine or livelihood, level of loneliness, sadness, destructive alcohol and drug use, and self-harm or suicide conduct are predicted to grow. According to a national study conducted by the Ministry of Health in 2020, 1 in every 3 Malaysian persons aged 16 and above, which is 29.2%, would have a mental health disorder, nearly tripling from 11.2% in 2006. The state with the greatest frequency of mental health issue are Sabah, Kelantan, Kuala Lumpur and Sarawak. 1 in every 5 Malaysian teenagers aged 13 to 17 suffer from depressions, 2 in every 5 suffer from anxiety, and 1 in every 10 suffer from stress, and this means 10.1% of young people have tried suicide. Okay, I think that's all from me, and now I would like to pass to Nabila for the conclusions.
Thank you Nurul Husnina for your explanation. Assalamualaikum, my name is Nurul Nabila binti Zamri and I will summarize on the topic discussed today. COVID-19 pandemic has affected the world in various ways. Therefore, we should take precautions to avoid being infected with COVID-19 virus. As when Zahira has mentioned before, we should put on a face mask and wash our hands. Wearing a face mask that covers your nose and mouth will minimize your chance of spreading and getting the disease. Meanwhile, washing hands with soap and water can help prevent the spread of germs such as viruses and bacteria. However, COVID-19 also gives detrimental impacts on us. As Nurul Husnina has highlighted, it impacts our physical health and mental health. Some former COVID-19 patients admit that the virus affected the quality of their physical health. They often easily feel weak, dizzy, and experience shortness of breath even when not doing their heavy activity. Furthermore, 1 in every 5 Malaysian teenagers aged 13 to 17 suffers from depression, 2 in every 5 suffer from anxiety, and 1 in every 10 suffers from stress. The saddest is 10.1% of young people have tried suicide. To sum up, COVID-19 is a dangerous disease and should not be taken lightly as it gives the worst impact on our lives. Therefore, I hope people are aware that we should always be vigilant during this pandemic by adhering to precautions such as putting on a face mask and washing hands properly to reduce cases of COVID-19 infection and become its victim. So far, vaccines are the only cure for this disease. COVID-19 vaccinations are effective and can reduce your chances of contracting and transmitting the virus. It also helps avoid major illness and death. Hence, do not be selfish. Please get vaccinated and protect yourself and others from infection by following the SOP properly. I think that is all from me and my team. Thank you and stay safe everyone.